Welcome. Welcome to our open house. So just a few words on my perspectives on an open house. I've had the privilege through Recovery Centers of America to be part of an open house. This is the second open house facility for an opioid treatment medication-assisted facility. And an open house is an opportunity for us to welcome you into what is a beautiful facility, but more importantly, to open you up to our minds, our hearts, and our souls, to let you know that we're compassionate about the services that we want to provide to your community. We don't go into this blindly. I'm sure all of you have had some experience with quote-unquote methadone programs. And the opinions of methadone facilities are sometimes not good ones. And it's not the fault of the individuals coming into treatment. It is a responsibility, and we take this very seriously, to integrate with the community to establish a better quality of life, not just for individuals, but for the community at hand. And we can't do this working in a silo. We can't do this utilizing medications, thinking that medications are a magic bullet. We can only do it by true integration and partnerships. Not only clinical partnerships with individuals who are providers of care in the space of drug and alcohol addiction, but also medical providers, social service providers, and I think a partner that is not mentioned often enough are providers that provide safety for our community in the criminal justice system. If we don't provide those partnerships, this jewel that you're looking at today can soon become an eyesore. So, in providing treatment and care, we also provide information and we provide guidelines to our patients as to how to maintain this as a true jewel of the community. One of the other essential factors that we all have to do is listen. Listen to you as a community. This is your community. And we want to become part of that. And we want it to be a long-lasting relationship. So, a little bit about what we do here. We provide drug and alcohol treatment. What's special about us is that we're licensed and certified to provide medications. One of the most important medications that we provide is methadone. Methadone has been used in the treatment of opioid use disorders for over 50 years. Started back in the 60s. Most of the treatment programs back then were isolated, out of sight, out of mind, and unfortunately, that is one of the factors that I feel has led to a chronic disease metastasizing and becoming an epidemic. When we look at other chronic diseases such as hypertension, diabetes, heart disease, Medical science has not only worked on the parameters of treatment, but how do you prevent it? Unfortunately, in this space, we've sort of ignored the prevention side and not extended enough into addressing the disease from that perspective. And in that, we have prevention programs that work very well, that work with individuals. There has not been enough done to work with community members, all community members. So the medications, whether we're talking about methadone, buprenorphine naloxone, which is commonly referred to as Suboxone, naloxone, or its long-acting formulation, naltrexone, and other medications. Some medications are specifically designed to treat alcohol use disorder, such as Antabuse. As a caveat, this is a great place to treat an individual who has an opioid use disorder that's on methadone and has an alcohol issue. Because what we can do is provide the patient with referrals to be withdrawn from alcohol, and when they come back out, we have the ability to prescribe and administer a medication called Antabuse. Now, Antabuse has been around for years and years and years, and for those old heads in the room like myself, if the patient is taking it correctly, under observation, they get a very negative reaction to taking it. So, you have all the parameters here to do that. So, we have a wonderful opportunity, and we thank you so much for welcoming us into your community. And we want this to be the first of many encounters. Not only coming onto our turf, but also to come to your turf and see what ways we can be instrumental in helping us achieve a healthy community. I like to reflect on something that's been heavy on my heart since yesterday. And this is a story that is not so often told. I had a patient who I began treating in the space of methadone treatment 25 years ago. It's when the county had a program in Blackwood on the campus of Lakeland. And it was a small program. This individual was in his 20s. He was addicted to heroin. That's when they were really selling heroin. These days they're not. Every package we see has fentanyl and an array of other things, which is our challenge. But he started out in methadone treatment and successfully became stable, got off opiates. And then in 2004, with the introduction of buprenorphine naloxone in the form of Suboxone, he made that transition from the methadone to the Suboxone. Did it as an inpatient, remained stable for years. During that time, he went through life's challenges. He had a sister who was also my patient, who unfortunately overdosed and died. He did not choose at that time to medicate his pain and his grief with going back to opiates. His mother, who was the pillar of the family, passed away suddenly from cancer. He himself, about 3 years ago, began losing weight and developed pain in his neck and his arms, didn't know what was going on. His physicians didn't know what was going on. But through that process, something very interesting happened. Instead of this individual going to a physician and getting an opiate to treat his pain, he came to me and he said, I'm seeing this doctor who is trying to find out what's going on. What do you recommend? And I said, well, I want you to sign a release so that I can communicate with your doctor. The doctor and I communicated back and forth. I was advising him not to treat him with opiates because I didn't think that his pain was going to be relieved by opiates. That opiates, additional opiates, were not going to be effective for him. We need to find a diagnosis. But moving forward, we finally got the individual over to the University of Pennsylvania. And he was diagnosed with a rather rare tumor, which was resected. The specialist at the University of Pennsylvania, who was a specialist in this area worldwide, said this was one of the largest tumors that he had ever resected. And with treatment, chemotherapy, and other medications, we were able to get him through his surgery. We were able to help him get back to a healthier life. He was in remission. He was going through a very difficult divorce, which he completed not using opiates. I have his medical reports from the University of Pennsylvania. We communicated back and forth. And he returned to a wonderful quality of life. One in which his children and his family and his co-workers looked upon him with dignity and respect. He continued to work. He paid his taxes. He was involved with his children. And unfortunately, a week ago, he didn't wake up. So one would think, well, that's a pretty sad ending. But it's not. It's that the goal is not thinking that we're going to save the life. The goal on a day-to-day basis, if that person makes the right decision, we can be part of their experience in improving the quality of their life. And that's what a facility and services provided out of this facility is all about. Helping a person have enough trust in us to walk the walk with them, to not judge them, to be there when they make a poor decision to help them make a better decision. How to utilize the medication in the most effective way. A lot of times patients don't like what we have to tell them. However, they accept it when they see that we're still there and we're still supportive. We're there to show them, or we're here to show them, how to be respectful of other members of their community. How not to look at guilt and shame, but how to look at being respectful and uplifting. And by trusting, they become meaningful to themselves and to their community members. So again, I know I didn't get into the ins and outs of the pharmacology of the medication. I often tell my patients, it's just the medication. The bulk of the work is done through change. Change of how you look at yourself. And I can tell you, 99.99% of my patients are good people. They're good people. They're human beings. And they go through a lot of pain and stigma. A lot of it may certainly be brought onto themselves. But through positive change, they can begin to experience a meaningful life. So again, I thank you all, and I will now turn the microphone over to the founder and the person responsible for us at Bravo Medical being here today. Thank you very much.
Thank you, Dr. DeShields. We could not do what we do without your dedication. I remember when we first bought Lighthouse, having my early conversations with Dr. DeShields, and what impressed me the most is his commitment to our patients every day. And the other thing that impressed me is I think I'm pretty tough in the mind, but I met my match with Dr. DeShields. So we've had some great debates over time. I'm going to put this down also. So I just want to give you some background on who we are and what we do and why we're here today. Some of you have heard some of these stories before, so humor me if you will. I had 6 brothers in my family, no girls. We had a female dog. My mother said the only woman she can talk to on a daily basis was our dog. But my mother had cancer for 25 years, and there was never a moment when she went to a single doctor's appointment alone. One of my brothers or myself took her to every doctor's appointment for 25 years. And it was an interesting phenomena. You know, every 2 years, a tumor would show up. And we'd go to University of Pennsylvania, and the doctors would come up with an operation, and they would remove the tumor, and then they'd run some tests, and they'd say, it's a miracle. Your mother is clear of cancer, she's gonna live to be 100, everything's fine. And we would, of course, be elated. And 2 years later, a new tumor would show up, and a new operation. And this literally went on for 25 years. And she lived a very full life, had lots of friends and a big family. And as we got toward the later part of those 25 years, the operations got more severe and the implications got more severe. And I remember one day asking Dr. Guzzo at the University of Pennsylvania why we're doing this. And he said, well, I'm gonna just make it simple. If we put your mother through this operation, I guarantee you she'll get an additional 5 years. And if we don't, the likelihood is she'll be dead in 12 months. And so that became an easy choice to make. And I have many observations in retrospective of all those experiences. One, nobody ever criticized my mother. They didn't criticize her for having cancer. They didn't criticize her for that cancer relapsing. They didn't challenge a payment on her insurance policy. They wouldn't dare, because after the 6 boys kicked the crap out of them, there'd be 10,000, Susan Komen marchers at the front door of the institution, or calling on our congresswoman or man. And there was an entire force around cancer. But my grandfather, her father, in the 50s got cancer. And it was a time when people didn't understand cancer. And the neighbors stopped coming around. And when he went in for chemo, he was in an isolated lead room nobody knew what was going on. People thought it was contagious. All the friends stopped calling. And cancer at that time was equivalent to AIDS in the 80s and addiction today. Addiction is a disease. That's a fact of life. Unfortunately, the world doesn't look at addiction like a disease. People look at addiction as a lapse in judgment. You could be doing just fine if you would just stop. That's like telling my mother, you could be doing just fine if you would just stop with your cancer. An absurd statement would be met with extreme physical response instantly. But today and every day, our patients have to go through that mental abuse. I will tell you that I have studied education. I did an LBO of a school system in Philadelphia, 17,000 kids. And I know for a fact there are no bad kids. I also know for a fact that there are no bad people suffering from addiction. There isn't a human being on this planet that is afflicted with the disease of addiction that is glad they have it. And what's unfair about it is it's random. You could have a family of 5 or 6 and one person gets it, and the other 5 are star athletes and A students, and the parents and siblings go through life saying, why can't you be like the rest of them? When in reality, it was a genetic formation at birth that makes that person predisposed to addiction. The second point I want to make is if somebody is here, they've made the decision to get help. They're tired of their life, they've hit bottom, and they're coming here to help to solve that problem. And by the way, people suffering from addiction affect the family and the community. And because addiction is so misunderstood and treatment is so hard to get, and I'm going to get into some of those statistics in a minute, oftentimes they steal to use again or buy street drugs to use again. Little statistic, opioid addiction is rampant, and if you're reading the newspapers, you're reading about all these lawsuits. Well, there were 2 major things that happened. One, we began incenting doctors to have patients with no pain. It was actually a checklist on patient surveys. Do you have pain? If the check was no, the doctor got points and made more money. If the check was yes, the doctor got less points and made less money. So the doctor said, well, that's easy. I'm going to make sure that my patients don't have pain. Then the pharmaceutical distributors and manufacturers caught wind of that and said, we can solve that problem. We're going to go see these doctors and say, not only are your patients not going to experience pain, but you're going to score higher on your survey, which means you're going to make more money, which means you're going to have a more satisfied boss and more satisfied patients. So we shoveled legal opioids at these patients without regard to the addictive tendencies for definitely those who have the genetic makeup, but also for others because of the power of these drugs. We then got them hooked. And then we said, okay, you're hooked. You can't buy them anymore. Those pills that we shoved down your throat to get you high, so we could score high on our survey, you now can't buy them because we've got this database that says you can't buy them. So those street drugs became very expensive, $10 to $30 a pill, 6 pills a day. You can imagine what that costs on a weekly basis. In comes heroin, $5 for a bag of black tar. Well, that's easy. In the 60s and 70s, there was a dividing line. People didn't put the needle in their arm because of the pain. But in the 2000s, if I'm taking painkillers every day, I could put the needle in my eye and I'm not going to feel it. All I want to do is solve my disease and my craving. So I'll buy a Mack truck if that's what's going to solve it. Heroin is an easy choice. And now comes fentanyl. So the scumbags dealing heroin say, gee, I can buy $8,000 worth of fentanyl, which is 50 times more powerful, and create $30 million worth of street drugs. And I'm not going to pay to buy legit heroin, as awful as that sounds. I'm going to start mixing in fentanyl. Problem with fentanyl is, and heroin as well, but fentanyl is so powerful that a little too much kills you instantly. And we know it because we've seen it firsthand. And so the way it's cut is with a straight edge ruler in the back of an apartment in a garage. There's no weights and measurements. And so accidentally, a pure rock of fentanyl rolls into a dime bag. Somebody gets it and they're dead on the spot. And so I'm telling you all this because most of these problems started with a sports injury, a pulled muscle, somebody's pill that was in the medicine cabinet. All of them, were a lion's share of them started with a legitimate prescription from a legitimate doctor of a legitimate substance from a legitimate company. And so we sit here and we say, you know, I don't want those folks in my neighborhood. And that's not happening here, by the way. I'm honored to be here, and I am very grateful that we've been welcomed here. It's one of the reasons we chose this community. But within a 15-mile radius of where I'm standing right now, over 1,000 people in the last 12 months dropped dead. Just think about what 15 miles in. Make a marker of something that's 15 miles away and count to 1,000. It's not a little problem, it's a big problem. And the reason we're here is the folks using heroin and fentanyl and opioids are saying, help me. I want to get help. So let me tie that back to what Dr. DeShields is doing. When you are addicted to heroin and fentanyl, we taper you off of those drugs over a period of time. And just a fun fact, you know, something that I'm glad Dr. Shields brought up that is not often brought up, alcohol. Think about alcohol. We are facing a $16 billion media budget in our fight against alcoholism. Not only that, we're facing a bought media. The #1 spend on media is alcohol commercials. Just think about it. Watch a football game on Sunday. The dog gets the beer, opens it up, hands it to me. My dog never did that for me. I'm always a little upset when I see that. But anyway, and in between that, it's a pharmaceutical commercial. So the media is owned by the alcohol companies and the pharma companies. And that's why we never see anything. You don't see anything on TV about alcoholism. There's no specials on 60 Minutes. That issue never comes up. A detox of alcohol that's done improperly will kill you. A detox of heroin, you'll wish you're dead, but it won't kill you. And so in intensity, heroin is less than alcohol in detox, but I don't mean to underscore the importance. So what we do here is we take that taper and we spread it out over a year or longer if need be. And we take our patients to much lower and lower and lower doses so that they can maintain a sense of dignity without the cravings and the interruption of the disease, go about their lives, and over time wean themselves off physically and mentally. And the other thing we do here is we teach them how to live. Not just how to live in a life of addiction, but how to live, period. I will put the 12 steps against any self-help book in America. And we put our money where our mouth is. We have about 1,450 employees. About 550 of them are in our Second Chance program. People that have been in the disease of addiction and for whatever reason had a challenge in their life and came to us and we brought them in. And they are by far our best employees because they understand the pain and suffering that goes on every day. So we're here to help people in this neighborhood. We're committed 24/7. If you call our 1-800-RECOVERY number, Christmas, New Year's, snowstorm, tornado, hurricane, we will answer 24/7 in 6 seconds or less. And if you're in distress somewhere, we'll send a car out to get you. And we'll get you into one of our facilities immediately to get you help. We get calls from firemen, police departments, mothers, fathers, brothers, sisters, strangers on the street, and patients themselves. And I'm eternally grateful to everybody on our team that this year will treat nearly 24,000 patients across the United States to give them that same quality of life. When you look around this facility, we spend a lot of money on our facilities. They're all beautiful, and I'm a fanatic about clean. And we visit them often, and they better be clean and neat, and they are. And there's a reason for that. Part of rehabilitating a patient from a life of addiction is letting them know how important they are as a human being, and rebuilding that confidence that's been shattered by all the things that they were forced to do to solve their issues in addiction, and some of the unfortunate impact that they had on their friends and family. Because our patients know. It's easy to judge somebody, but once you realize how much they judge themselves and how hard they are on themselves and how much pain that they absorb for the things that they know they've done to hurt others, you begin to be a little more understanding. So from the minute they walk in our facility, they're the most important people in the world to us. And we want them to feel that way. And so everything we do is about helping our patients to rebuild that self-confidence and to go on and live the life that maybe their siblings got, because by the stroke of God, they didn't get the disease of addiction. And we think that's the ultimate fairness. So we thank you for joining us today, and we thank you for being part of our grand opening.